Bula Vinaka, good morning, warm Western Pacific greetings, distinguished representatives, ladies and gentlemen. I have great pleasure in declaring the 76th session of the World Health Organization Regional Committee for the Western Pacific open. I will now deliver my opening address. Honorable Ministers, distinguished representatives, our W.H.O. island boy from Tonga, our Regional Director for the Western Pacific, Dr. Saia Piukala, all representatives of agencies of the United Nations, intergovernmental organizations, non-governmental organizations, ladies and gentlemen, Bula Vinaka, Kia orana, and warm Pacific greetings again to us all. I thank our Heavenly Father for enabling us to be here on this ground, on this beautiful island of Fiji. And last night, that has set the scene for us throughout the week in committing everything into the hands of our Heavenly Father. It is my distinct honor and privilege to welcome you to this 76th session of the W.H.O. Regional Committee for the Western Pacific. This year holds special significance. For the first time in a decade, we are gathering in the Pacific. On behalf of everyone here this week, I extend our sincere gratitude to the government and people of Fiji for graciously hosting us. The Honorable Prime Minister, who availed his time, his busy schedule, to attend the opening last night, as well as our Honorable Minister of Health for Fiji. Thank you very much to you all for hosting us on your beautiful island. It is a true privilege for us all to be gathered here in Fiji this week, surrounded by our endless blue oceans, the blue skies, the luscious green hills, and last night's traditional welcome ceremony was very warm and respectful. It really symbolizes acceptance of our presence into your vanua. We acknowledge your traditional leaders, past, present, and future. We all could see that it is a country rich in cultural heritage and unique hospitality. Vinaka Vakalevu. I appreciate that many of you have traveled a very, very long way to be here. And I am grateful, along with my colleagues from the Pacific, for the sacrifice, because we all know it too well. We have done it for years, traveling across our large ocean to get to Manila. But today, this week, you have experienced what we used to go through. So thank you very much. I am delighted that our Western Pacific family has the opportunity to experience the warm spirit, the unity that defines the Pacific, our big ocean state. So in today's complex and challenging landscape, our unique solidarity in the Western Pacific is something to be cherished. It is what helps us find our way through. Distinguished representatives, it was an honor to be your chair for the past year. When I took on the role, I don't think any of us quite imagined how different the world and the global health architecture might look 12 months on. I really would like to acknowledge our colleague, our regional director, his leadership to drive. Over the year, we have seen remarkable achievements by all of us. Thank you very much to you, Adi, and your hardworking team. I would also like to thank you all again, those that I have mentioned, working behind the scenes, for the very hard work and progress over the year since we last met. Despite the challenges, and most importantly, preparing for this important gathering here this week. I am proud of what we have achieved together. This time last year, our regional committee endorsed the Regional Action Framework for Health Financing to achieve universal health coverage and sustainable development in our Western Pacific. This was an acknowledgement that despite our efforts, public health spending in the Western Pacific remains inadequate to meet growing needs. And because of this, people are being forced to choose between health and wealth, or more clearly, health and poverty. To help address these challenges, over the past year, our W.H.O. supported member states to develop and implement efficient, sustainable, and equitable health financing systems. Indonesia, Mongolia, and the Philippines, for example, have strengthened financing for primary health care, improving quality of care, especially for the most vulnerable. More member states in the region are generating using data, including health expenditures and new financial hardship estimates to be released this December coming for a stronger and more informed health financing and systems policy. The second item we endorsed was the Regional Action Framework on digital health. Digital health is growing at an unprecedented rate across the Western Pacific. However, these changes bring about new challenges related to governance, coordination with a wide range of actors, sustainable financing, and the ethical and secure use of digital health tools and data. The momentum created by the endorsement of the Regional Action Framework on digital health has guided member states in their drafting of national digital health strategies and plans. Member states are also increasingly reviewing and strengthening health data, governance frameworks within WHO support towards the rapid adoption of innovative, people-centric digital technologies in health, including artificial intelligence and greater interoperability between systems. We also discussed the growing need for transformative primary health care. Despite over 4 decades since the Alma Ata Declaration, many health systems in our region remain hospital-centric, with primary health care still under-resourced. As countries face aging populations, rising non-communicable diseases, and growing health security risk, transformative primary health care is more urgent than ever. Since our last RCM, WHO in the Western Pacific has been supporting countries in strengthening primary health care through a demonstration site approach, while employing a learning-based agenda. In countries such as Cambodia, Fiji, Papua New Guinea, and Vietnam, WHO is supporting in grassroots and subnational efforts to improving the essential health service package, improving health workforce and facility capacity, and integrated service delivery, financing, and digital health transformation efforts. Last year, we also began to tackle the important issue of oral health. In our region, the cases of oral health diseases such as tooth decay, gum diseases, tooth loss have grown by 30%, and this is over the past 30 years. 1 in 5 adults over the age of 60 have lost all their teeth, causing difficulty in eating, poor nutrition, and a lower quality of life. And I am sure we have experienced, some of us have experienced this. Oral diseases are largely preventable, but if left unaddressed, they cause pain and they reduce quality of life. Building on last year's agreement on 3 priorities: governance, lifelong oral health promotion, and integration into primary health care. I am glad that this year our regional committee will consider a Western Pacific regional implementation plan for the global strategy on action plan on oral health. Lastly, let me recall the historic show of support to WHO that took place during the investment round side event. 10 countries in the Western Pacific region have pledged to provide $12.1 million to support WHO's work. And this is just one of many important moments of WHO's investment round, which has to date raised over $2 billion in pledges, many of which came from member states that are around the table this morning. So a round of applause to all of us. This, combined with the recent approval by the 78th World Health Assembly of a 20% increase in assessed contributions, and other significant commitments from member states and partners has made a critical difference to WHO. These contributions have provided the organization with much needed stability, enabling it to navigate current global challenges with greater resilience than would have otherwise been possible. Distinguished representatives, we have achieved a lot over the last year, but there is still more that lies ahead of us all. Again, I would like to thank you very much for entrusting me as the chair of the 75th Regional Committee meeting. I am very, very grateful for the support of last year's office bearers, and thank you for the WHO Secretariat for all their efforts to support member states over the past year, as well as the preparation for this 76th Regional Committee meeting. Another round of applause, please. So I wish us all the very best for this week's deliberations. In closing, a wise saying of my forefathers to us all this morning, and I quote, "Kia ka tō rama e toki tarai e noa." May your torch or may your light continue to shine as we carve each other's nation for a better, for a safer and healthier future for all. And let us continue to weave health for all to ensure that no one is left behind. And to end us all this morning, may I leave us all with a Bible verse from Genesis chapter 12, verse 2. And it reads, "I make you into a great nation, and I will bless you. I will make your name great, and you will be a blessing." So I thank you very much again. Vinaka vakalevu, kia orana e kia manuia. May all our nations be blessed, and it is time for us to continue to action. Thank you very much. God bless us all. Where are we all this morning? Can we all say Bula? Bula vinaka. Okay, distinguished representatives, before we move on to our next agenda, I would like to call on, and it is an honor, to call on our Regional Director, Dr. Saia Piukala, for a brief message. It says only a brief message, but we will wait and see if it's going to be brief. Thank you very much, Dr. Piukala.
Thank you, Chair. Honourable Minister Antonio Lalapalavu of Fiji, our host this week. Honourable Minister Laine Tutai Rose Toki Brown of the Cook Islands, our outgoing chair, Honourable Ministers and representatives from Member States and partner agencies, ladies and gentlemen, good morning and a warm Pacific greetings. What a joy to be here in Nadi. It is a beautiful day. It's sunny outside, where the sun greets us with warmth, the breeze carries the spirit of the ocean, and the sense of unity among us is truly uplifting. Welcome to the 76th session of the WHO Regional Committee for the Western Pacific. To all our ministers and delegates, thank you for being here, and a heartfelt welcome to the Republic of Indonesia, joining us for the first time as the region's newest member state. Minister Pudi, we are honored by your presence and excited to walk this journey together. Salamat datang. There's a proverb that should guide our work. If you want to go far, go alone. If you want to go fast, go alone. If you want to go far, go together. This week, we go together. This past year has been a testament to what we can achieve together. Later, I will present the Regional Director's report covering our work from the 1st of July 2024 to 30th June 25. But first, allow me to share a few milestones that reflect the power of collective action. 1 month ago, 21 Pacific Island countries and areas were verified for measles and rubella elimination as an epidemiological block. This is historic. It shows what solidarity, commitment, and cooperation can achieve. Japan has also been verified for rubella elimination, but verification is not the finish line. The risk of outbreaks remains if we let our guard down. We must keep vaccination coverage high and surveillance strong. Fiji and Papua New Guinea have eliminated trachoma as a public health problem. These victories remind us that diseases of poverty and vulnerability can be defeated when evidence, commitment, and community converge. In September of last year, the WHO Asia Pacific Center for Health and Environment in the Western Pacific region, known as ACE, was reinvigorated under new leadership and stronger investment. At the recent UN General Assembly, despite challenges in reaching consensus on the global NCD agenda, member states showed strong advocacy and commitment for tackling the leading causes of premature death. Of particular note was the focus on alcohol, a priority we are advancing boldly in the Western Pacific region. This week we will address climate and health, the international health regulations, alcohol control, and oral health. Technical discussions on mental health, hypertension, tobacco control, artificial intelligence, and safer surgery. These priorities reflect our shared commitment to health and well-being. We will also discuss the program budget for 2024, 25, and 2026-27. This follows months of reprioritization and restructuring, often through long nights and difficult decisions. And let me speak from the heart. This has been one of the most painful periods of my career. Financial hardship forced us to make difficult decisions. We had to downsize the organization. And yes, we had to say goodbye to beloved colleagues. People who have been part of the WHO family, who have served with dedication and helped shape our mission of health for all. Letting go is never easy. We work in coordination with headquarters and other WHO regions. We did everything we could to protect the integrity of our work and the dignity of our people and our colleagues. Through it all, we have kept countries at the center. We remain committed to impact, accountability, and transparency, even with fewer resources. The organization is stable, the Secretariat is strong, and together we will continue to navigate this complex environment with courage and clarity. When we gather each year, we may not solve every problem, but we consolidate, we synergize, and we take collective action. If you want to go fast, go alone. If you want to go far, go together. This is our guiding light. Indeed, going together is our goal as we continue weaving health for families, communities, and societies. And as we look across our region, we find inspiration in the Pacific, where Healthy Islands vision was born, in Yanuta Island, just an hour away from where we are now. It was here 3 decades ago that a group of visionary health leaders came together and imagined a future in which children are nurtured, environments are clean, and communities thrive in harmony. This vision remains as relevant today as it was then. And this weekend, Pacific Health Ministers will renew and revitalize it, looking back with pride and forward with purpose. Cardinal Luis Antonio Takale of the Philippines once said, "We are not owners, we are stewards. And stewardship begins with seeing others not as a problem to fix, but as people to love." In the Western Pacific region, we are all stewards, the kind who offer hope, healing, and humanity at every level of our systems. This week, let's steward our region with compassion. Let's listen deeply and speak boldly and collaborate generously. Let's mark the beginning of a week filled with fruitful discussions, courageous decisions, and renewed commitment to our shared mission. Together, we pedal the waka. Together, we chart the stars. And together, we weave the mat, each strand a voice, each thread a commitment, each knot a shared value. The mat we weave this week will not only carry the weight of our aspiration, it will become the foundation on which our region stands stronger, more united, and more compassionate. And before I close, let me thank our outgoing chair, the Honorable Minister Vainetutai Rose Toki Brown from the Cook Islands, the outgoing Vice Chair, Vice Minister Professor Huong Thi Lien from Vietnam, and our rapporteurs from the 75th session of the Regional Committee. Chair, your service over the past year has been nothing short of heroic, steering us through agendas, acronyms, and action items with grace, grit, and good humor. You've kept the region on course, even when Wi-Fi didn't cooperate and coffee ran low. We are grateful for your leadership, your wisdom, and your unwavering commitment to public health. As we say farewell to your tenure, we don't say goodbye. We say vinaka vakalevu and thank you for leaving the region in a better position for the new chair to build on. And as someone once said, Leadership is not about being in charge. It's about taking care of those in your charge. You have just done that. Now enjoy the well-earned break from the chair seat, but don't get too comfortable. We may call you back again. So thank you all, and I wish you all a successful regional committee. Thank you.
Thank you very much to our RD, Dr. Piukala. So I don't know what your feelings are, but for me, this is the Pacific brief speech. That's a Pacific way. Brief in a Pacific context. So now, ladies and gentlemen, we will move on to the election of our chairperson. We now proceed with the election of new officers, beginning with the chairperson. I now call for nominations for the office of chairperson. I see Australia. You may take the floor.
It gives me great pleasure to nominate our generous host, Fiji, for the post of chairperson.
Thank you very much, Australia. Australia has nominated our Honourable Minister from Fiji as chairperson. Are there any seconders? I now call on Vietnam to take the floor.
I second the motion nominating Fiji to be elected for the post of chairperson.
Thank you very much to our representative from Vietnam, who has seconded our representative of Fiji for the office of chairperson. Are there any other nominations? If there are none, it gives me great pleasure in pronouncing our representative of Fiji, the Honourable Ratu Antonio Rabiki Lalab Balavu, our Honourable Minister of Health and Medical Services, as our new chairperson. Ladies and gentlemen, once again, I would like to thank you all and other officers of the last session, the 75th session, and I wish our new chairperson all the very best for this meeting. I am sorry, ladies and gentlemen, I'm always breaking protocol. I have a small gift for our RD on behalf of all Western Pacific member states. Thank you.
Distinguished representatives, I thank you all for electing me as chairperson of the 76th session of the Regional Committee of the Western Pacific region. I would like to ask for your indulgence in allowing me to postpone my address to the committee until tomorrow morning. And now, we proceed with the election of the Vice Chairperson. Distinguished representatives, are there any nominations for the office of the Vice Chairperson? Philippines.
Thank you, Mr. Chair. I respectfully nominate Japan to be elected for the post of Vice Chairperson.
Thank you. The representative of the Philippines has nominated the representative of Japan for the office of the Vice Chairperson. Are there any seconders? Papua New Guinea.
Thank you, Chair. I second the motion nominating Japan to be elected for the post of the Vice Chairperson.
Thank you, representative of the Papua New Guinea has seconded the nomination of Japan for the office of the Vice Chairperson. Are there any other nominations? There being none, I have much pleasure in pronouncing Dr. Satoshi Ezo, Senior Assistant Minister for Global Health, Ministry of Health, Labor and Welfare of Japan, as Vice Chairperson. Now we come to the nominations of our rapporteurs. May I ask the first for nominations for the office of rapporteur for the Chinese language? Solomon Islands.
For the post of rapporteur in the Chinese language of the 76th session of the W.H.O. Regional Committee for the Western Pacific region, I have the pleasure to nominate Hong Kong, SAR, China, to be elected for the post of rapporteur in the Chinese language. Thank you.
Thank you. The representative of the Solomon Islands has nominated a representative of Hong Kong, SAR, China, as Chinese rapporteur. Are there any seconders? Malaysia is recognized.
Malaysia second the motion nominating Hong Kong Special Administrative Region, China, to be elected for the post of rapporteur in the Chinese language. Thank you.
Thank you. The representative of Malaysia has seconded the nomination of a representative of Hong Kong for the Chinese rapporteur. Are there any other nominations? There being none, I have much pleasure in pronouncing Dr. Ambrose Wong Chi Hong from Hong Kong, SAR, China, as the Chinese rapporteur. May I now ask for nominations for the Office of Rapporteur for the English language. The representative of Singapore.
I respectfully nominate Brunei Darussalam to be elected for the post of Rapporteur in the English language.
Thank you. The representative of Singapore has nominated a representative of Brunei Darussalam as English Rapporteur. Are there any seconders? I can see the member of Micronesia.
I second the nomination, the motion nominating the representative from Brunei Darussalam to the post of Rapporteur in the English language.
Thank you. The representative of Micronesia has seconded the nomination of a representative of Brunei Darussalam for the English Rapporteur. Are there any other nominations? There being none, I have much pleasure in pronouncing Ms. Nore Samsia Hussein from Brunei Darussalam as our English Rapporteur. Well, this is a new experience, so bear with me. May I then ask for nominations for the office of Rapporteur for the French language? Thank you, Vanuatu.
I have the honor to nominate France to be the elected for the post of Rapporteur in the French language. Thank you.
Thank you. The representative of Vanuatu has nominated a representative of France as French Rapporteur. Are there any seconders? Thank you, Cambodia.
Honorable Chair, I am pleased to second the nomination of France to be elected for the post of Rapporteur in French language. Thank you.
Thank you. The representative of Cambodia has seconded the nomination of a representative of France for French Rapporteur. Are there any other nominations? There being none, I have much pleasure in pronouncing Mr. Benjamin Beckers from France as French Rapporteur. Thank you very much. Congratulations to my fellow office bearers, and I look forward to working with you all to ensure a smooth and efficient meeting this week. Before we move to the next agenda item, I would like to take this opportunity to mention that this year's regional committee is a special one. As Minister Brown mentioned, this is the first time in a decade that we are holding the regional committee meeting in the Pacific. Also, this will be Indonesia's first session as a member of the Western Pacific Regional Committee, after their reassignment to our region this year. To our newest members of state, the Western Pacific region warmly welcomes you. We are glad to have you here. And I now give the floor to the Honorable Budi Gunadi Sadikin, Minister of Health of Indonesia. Mr. Budi, the floor is yours.
Thank you, Chair, Excellencies, and distinguished delegates. Bula Vinaka. Just last night, Prime Minister Rabuka welcomed us with Fiji traditional ceremony. And I must say, I truly love the Bula shirt he gave us. It is very vibrant with its colorful pattern. While Bula has long been a proud Fijian heritage, to me, it speaks more than that. Bula means life, health, and happiness. It captures the warmth of the Fijian people, while carrying a powerful message that health is not only about medicine or technology, but the spirit of caring for one another. I believe that Bula's spirit also represents what connects us together as a region, that every person, no matter where they live, deserves the chance to live a healthy and dignified life. It is that same spirit of connection that Indonesia sincerely appreciates the warm welcome to our reassignment to WHO Western Pacific region. Distinguished delegates, the Western Pacific region has long played a unique role in connecting nations large and small, coastal and mountainous, through its priority program, Weaving Health, as a shared fabric of innovation and solidarity. Indonesia is proud to be part of that fabric, and we look forward to learning from W.H.O resilience and community-based approaches while sharing Indonesian lessons from health reforms. Ladies and gentlemen, aligned with regional priorities, Indonesia health system transformations built on the spirit to reach the unreached. Primary healthcare is dear to my heart. We are reforming our primary healthcare, standardizing and digitalizing 10,000 primary healthcare facilities that we call puskesmas across 7,000 inhabited islands to serve 280 million of Indonesians, equipping them with cutting-edge technology, which include ultrasound facilities, dental chair, ECG for thrombolysis services, comprehensive blood and molecular biology lab, and including X-rays with artificial intelligence facilities. We also integrating digital health through single Satu Sehat platform or digital apps, and connected through 7,000 Starlink network. To accelerate our progress, in February we launched our most ambitious healthcare program, free health screening, targeting 280 million Indonesian citizens. To date, it has already screened over 45 million people, with average 500,000 people screened daily to prevent diseases rather than to cure them. We are also, with the help of the World Bank financing, expanding hospital referral capacity, particularly for four most catastrophic diseases: stroke, heart disease, cancer, and kidney diseases. We are installing 514 CT scans, cath lab, chemotherapy facilities, and hemodialysis facilities in all cities of Indonesia, and installing 34 MRI, LINAC, SPECT-CT, PET-CT, and robotic surgery in 34 provincial hospitals. Distinguished guests, when I received my Bula shirts yesterday, I instantly felt familiar. In Indonesia, we also have our form of fabric or identity, woven in color, pattern, and meaning, like what I wear today. We call it a batik. In the same spirit that unites us at this regional meeting, we would like to invite you to the Batik Day celebration tomorrow and distribute all the batiks for all of you as a gesture of our gratitude for the warm welcome to W.H.O. WIPRO. Indonesia reassignment to Western Pacific region represents not merely a geographical shift, but a form of collective action and regional collaboration. We believe our culture and bond, together with WHO Western Pacific region, we will continue to weave health across our nation, community by community, for a healthier family, community, and society. Therefore, to close, Indonesia humbly proposes Bali as the host city for the 78th sessions of the Regional Committee meeting of WHO Western Pacific region in 2027. And welcome you all. Thank you.
Thank you, Minister Budi, and thank you also for a batik that will be shared between members and delegates tomorrow, but more so, Indonesia's strengthening of primary health care. And with that, we will move to the next agenda item. Distinguished representatives, document WPR/RC76/1 contains the provisional agenda. Are there any comments? Thank you. So in the absence of comments, the agenda is adopted. Distinguished representatives, ladies and gentlemen, we will now move to the next agenda item. It is now my great pleasure to introduce Dr. Tedros Adhanom Ghebreyesus to deliver the Director General's address. Unfortunately, Dr. Tedros will not be joining us in person, but he is connected online to deliver this message. DG, many thanks for joining us at such late hour. May I now call on Dr. Tedros.
Thank you, Chair, and congratulations. Can you hear me? Our outgoing Chair, Minister Toki Brown, incoming Chair, Minister Lala Mabalavu, Honorable Ministers, Ambassadors, and Heads of Delegation, Regional Director Dr. Saia Piukala, Bula Vinaka, and good evening from Geneva. I think good morning to you, and it's around midnight here. I'm very sorry I can't be with you in person, but thank you for accommodating me virtually. I have very, very good memories of Nadi and Suva. I have been to Fiji a couple of times, but I would have loved to be with you. But I hope you will forgive me because it's because of some difficulties that I couldn't join you. And I thank Fiji for hosting this year's regional committee and for your support for the World Health Organization. I'm delighted to see the regional committee returning to the Pacific for the first time in a decade. I would also like to join member states in welcoming Indonesia to the Western Pacific, and I send warm greetings to my friend, Minister Budi, and thank you for your excellent speech. I thank the Regional Director, Dr. Saia, for his report, and I congratulate member states for the many impressive achievements it describes. In every single country, there are successes to celebrate and challenges to confront. I'm pleased to see progress against each of the 5 vertical strands and each of the 3 horizontal strands of the regional vision. Many countries are taking action against tobacco, NCDs, and making progress towards disease elimination. Other countries are protecting girls against cervical cancer, expanding treatment for neglected tropical diseases, taking action against AMR, and strengthening their emergency preparedness and response capacities, and more. Of course, you also face many challenges, which are reflected in your agenda this week. Climate change remains an existential threat. So the regional implementation plan for climate change and health system safety and resilience is an important step forward, especially for small island states. The amended international health regulations are a central pillar of global health security, and the implementation plan for the revised IHR will help to make the region safer. Oral health is a neglected area of public health, which the regional implementation plan will help to address. And alcohol, as my brother Saia said, is a major driver of disease and death. So your work on accelerating implementation of the WHO Global Alcohol Action Plan is very important. Honorable Ministers, dear colleagues and friends, at this year's World Health Assembly, member states sent a very powerful message that a strong and empowered WHO is what they want. First, the approval of the next increase in assessed contributions was a major step towards WHO's financial sustainability and to protecting it from our future shocks. And I agree with Minister Brown that the appreciation goes to you, and please accept my appreciation and deep respect. And second, the adoption of the WHO pandemic agreement was truly historic, demonstrating that in these divided times, countries can still come together and find shared solutions to shared problems. The WHO Secretariat is committed to supporting all member states in this work. But as you know, we're facing a very difficult situation. We have been undertaking a major restructuring this year at headquarters and in every region, including the Western Pacific. We began at the top, reducing the number of senior managers and directors at headquarters almost in half. Over the past few weeks and months, we have been through a painful process of saying goodbye to a large number of colleagues, as my brother Saia indicated earlier. These are people who have served the world in many ways, including under extreme pressure during the COVID-19 pandemic, and do not deserve to be treated this way. But we see this crisis as an opportunity to build a WHO that's more focused on its core mandate, more independent and more able to deliver for member states and the people we all serve. and we're looking for models to do more with less. Honorable ministers, dear colleagues and friends, I leave you with 3 requests. First, I urge all member states to engage actively in negotiations on the PAB's annex to the pandemic agreement and to conclude it in time for next year's World Health Assembly in May. The pandemic agreement will not be complete without the annex. Second, I urge you to use every tool at your disposal to generate financing for health and improve efficiency as you build a more self-reliant future, free from aid dependency. WHO stands ready to support all member states to do that, and we can support you both in designing immediate solutions and long-term solutions. And third, I urge you to seize this opportunity to work with us to build a stronger, more empowered, and more independent WHO that's better able to serve all countries. And I look forward to continuing to work with my colleagues in the regional office, starting from my brother Saia, and with all member states as we work together to promote, provide, and protect health in the Western Pacific and everywhere. Vinaka Vakalevu. Thank you very much. And back to you, Chair.
Thank you very much, Dr. Tedros, for joining us online, and we hope you get to have some very much needed rest soon. And as advised earlier, since the Director General is not here in person, we will be not taking any interventions on this item. Now I would like to invite the Secretariat to provide a short briefing on how we will organize our work this week. May I now call on Dr. Susan Mercado, Director of Program Management. Dr. Mercado, over to you.
Thank you very much, Chair. For the agenda for the whole week, let's go to the next slide, please. So the meeting proper starts at 9 o'clock every day and ends at 5 o'clock in the afternoon. We have a coffee break at 10:15 to 10:30 and a lunch break from 12 o'clock to 2 o'clock in the afternoon. In some of the days, there will be side events, and I'll get to that in a moment. From 3:15 to 5:30, we have a coffee break, and then we have the afternoon session. Let's go to the next slide, please. So for today, we have in the morning from 9 to 10:15, items 1 to 3 and 5, which is the opening of the session, addressed by the outgoing chairperson, election of new officers, chairperson, vice chairperson, rapporteurs, and adoption of the agenda. That's where we are right now. From 10:30 to 12, we'll have items 6 and 7, addressed by the Director General, which is already done. We move that forward a little bit. Addressed by and report of the Regional Director. And in the afternoon, we have the address by and report of the Regional Director continued. And from 3:30 to 5 o'clock, we have program budget 2024-25 budget performance. In the evening, of course, will be the Regional Director's dinner. Next slide, please. Tuesday, day 2, we have the address by the incoming chair, continuation of program budget 2026-27, and from 10:30 to 12, the agenda item on climate change and health system safety and resilience. And then in the afternoon, at 2 to 3:15, we have implementing the international health regulations for 2005 amendments, and then the agenda item on oral health. There will be a caucus in the evening. Next slide, please. Then we have the management of, we have the morning session on alcohol, and then we have coordination of the work of the World Health Assembly, the Executive Board, and the Regional Committee, agenda for the 77th session of the Regional Committee. And in the afternoon, the work of WHO in countries, regional membership in the Executive Board, items recommended by the World Health Assembly and the Executive Board. Next slide, please. Thursday, we have consideration of resolutions, and then we will have an expert speaker on shifting mental health care to address global challenges, and the start of some technical discussions, the first being on artificial intelligence in healthcare systems. The afternoon will be a field visit to health facilities. Friday, we will have hypertension control and safer surgery, and then tobacco control as a continuation of the technical discussions. And then in the afternoon, we have accreditation of non-state actors and other items like WHO reform, additional topics, if any, and the special program of research, development, and research training in human reproduction, membership of the Policy and Coordination Committee. From 3:30 to 5, we have the time and place of the 77th and 78th sessions of the Regional Committee and closure of the session. Before I go to the practical reminders, let me just announce that we have a couple of side events. The side events are not really considered part of the agenda of the Regional Committee, but are opportunities for the member states to converge, to share experiences, and to discuss some special topics of interest that have been proposed. So we will have a launch of the WHO Asia Pacific Center for Environment and Health in the Western Pacific region this afternoon. There is a 5-year strategy that will be launched. There will also be an event by the World Bank on primary health care. Tomorrow, we will have the WHO Pandemic Agreement updates and progress of the Intergovernmental Working Group. That will be Tuesday afternoon. Wednesday afternoon, we have Scaling Up Solutions Confronting HIV and Substance Abuse in the Western Pacific region. And on Thursday, we have a session on climate resilient and environmentally sustainable health systems and facilities, making it a reality across the region. So all of these side events will be announced right before they start, so you will be properly informed. Now, some practical reminders. So every member state will have 3 minutes to speak. For individual statements of partners, that would be 2 minutes, and for group statements, the limit is up to 4 minutes, and there will be a timer on the screen. To speak, please press the big button on the microphone, so you've got 2 buttons there in front. And if you have written interventions, notes, or scripts that you would like to share with the Secretariat, kindly send them to this address, capital WPRCM, interventions@who.int. For draft resolutions, these will be available on the RC76 SharePoint portal tomorrow. So the rapporteurs and our editorial team will be meeting at the end of each day to take up resolutions or other relevant documents of the meeting. Thank you very much, everyone.
Thank you, Dr. Mercado. Thank you very much for that brief. And as Dr. Mercado has mentioned, we ask all honorable delegates to keep your interventions concise this week, as you do have a very, very busy program. And I look forward to working with you all of you to get this through our agenda. And before we continue, there is one other important issue I would like to briefly mention as chair of the RCM. As you're well aware, WHO has a zero-tolerance policy for any form of harassment and sexual misconduct at any WHO event or WHO premises. The organization is committed to enabling events at which everyone can participate in an inclusive, respectful, and safe environment. All participants are expected to behave with integrity and respect towards each other and everyone involved in this event. That should be easy, you in Fiji. If a participant has a concern, please speak to Dr. Rodel Odora, the Acting Management Officer, Prevention and Response to Sexual Misconduct, and Dr. Wendy Snowden, the WHO representative to Samoa, American Samoa, Cook Islands, Niue, and Tokelau. Reports or complaints can also be made to the WHO Office of Internal Oversight Services at the email address on the screen now. WHO has also a zero-tolerance policy for inaction in these cases, so all concerns will be handled conscientiously and confidentially. And lastly, I would like to ask you to speak slowly, clearly into the microphone. This is very important for our fellow delegates and the interpreters. And before we break for coffee, we need to take a group photo, which will be outside and by the beach. And we all have to return back at 10:45. Please do return back. And I now call on the Regional Communication Manager to provide the details of the group photo.
Good day, everyone. For the photograph, we would like to make it as quick and efficient as we can. And there is a spot outside where we will all convene. And name tags have been placed on the ground so the countries know exactly where they should be standing. And we will have further instructions once you're outside. So please make your way at the appropriate time. Outside here and then to the left. Thank you.
As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization. As we come together to serve our communities, this is a reminder that any participant in this event must abide by the Code of Conduct to prevent harassment, including sexual harassment at WHO events. We have zero tolerance for sexual misconduct. If you have any concerns or suspicions about sexual misconduct that may occur during this event, please report directly at investigation@who.int or through WHO's Integrity Hotline. Protecting communities, members of our workforce, and collaborators is a priority to the World Health Organization.
Thank you, distinguished representatives, delegates, excellencies. Welcome back. I hope you now feel refreshed after a short break. And we will now move on to item 7. You should have before you document WPR/RC76/2, report of the regional director, the work of WHO in the Western Pacific region. And it is now my pleasure to invite our RD, Dr. Piukala, to make his address to the committee. Dr. Piukala, the floor is yours.
Chairperson, Honorable Antonio Lalapalavu, Honorable Ministers, distinguished representatives from member states and partner agencies, ladies and gentlemen. Good morning, colleagues and friends. A year ago, we embraced the metaphor of weaving a mat, a symbol of unity, strength, and shared purpose. Today, as I look back on the past year, I am deeply moved by what we have woven together. The mat we envision is now vibrant with color and meaning, each strand representing the dedication, innovation, and resilience of our region. It is with great pride and humility that I present to you highlights from the report of the World Health Organization in the Western Pacific region, covering the period from 1st July 2024 to 30th June 2025. This year's achievements are not just milestones, they are reflections of your leadership. You are the drivers of change, the energy behind progress, and the reason we've been able to advance primary health care, climate and health system resilience, emergency preparedness, health promotion, and digital transformation. Only leaders like you, committed, courageous, and collaborative, can make this happen. Together, we are not just improving health systems, we are saving lives. We are shaping futures. And we are proving that when we weave together, we create something far stronger than any one strand alone. While we gather today to celebrate our collective achievements, I must also acknowledge the weight of the world we are navigating together. The year 2024 was the hottest year on record, underscoring the climate crisis. Rising temperatures have disrupted our food systems. Melted polar ice stirred our oceans and tested the resilience of our cities, islands, and communities. Climate change has also affected our bodies and burdened our minds. Looking north, the extreme winter in Mongolia limited healthcare access and killed millions of livestock, threatening the livelihoods of herding communities. In the east, the Vanuatu December earthquake disrupted hospital clinical services. In the west, seasonal typhoons, including Typhoon Yaki, displaced populations and damaged hundreds of healthcare facilities in the Lao People's Democratic Republic, the Philippines, and Vietnam. And for the first time in decades, we saw armed conflict on the Thai-Cambodian border. We are living in a time of permacrisis, a world where emergencies are constant. But amid this turbulence, one truth is undeniable. Health remains the foundation of peace, prosperity, and survival. This year's report is not just a record of activities. It is a reflection of how, together, we have stood firm in the face of adversity. It shows how the regional office, with a renewed management team, has worked hand in hand with our 38 countries and areas and our partners to provide steadfast support at a time of great uncertainty. Our work this year has been guided by a shared vision that health is not a luxury, but a right. That health is not a sector, but a pillar, essential to individual dignity, community strength, national resilience, and global solidarity. The lessons of the COVID-19 pandemic are as relevant as ever. We must continue a dual-track approach, delivering people-centered care through strong primary health systems and preparing better for emergency arriving faster than before. Yes, we are facing financial challenges triggered by the withdrawal of key donors and shifting global priorities. But these challenges have also opened new doors. We are seeing a powerful shift toward more South collaboration. Countries are stepping up, crafting their own plans, investing their own resources, and leading their own futures. This report captures this momentum in the first full year of implementing our regional vision, weaving health for families, communities, and societies. This narrative is not just about what WHO has done, it is about what you have achieved. As your Secretariat, we have simply woven together the threads of your work, country by country. While this report cannot capture the full depth of your efforts, it offers a powerful glimpse into what is possible when we act as one region, united by purpose and driven by impact. The 5 vertical strands of our regional vision have helped organize our collective action. The 3 horizontal enablers have strengthened our ability to support you, our member states, more effectively and more responsively. As we present the program budget this week, we will also show how are we aligning our resources to where they are needed most, in your countries, in your communities, and on the front lines of care. In my travels across the region, I have seen firsthand the courage of our health workers, the innovation of our ministries, and the resilience of our people. I have seen that when we come together, we do more than respond, we transform. In the face of storms, we do not unravel, we tightened the weave. Measurable outcomes are not just a theme of this report. They are the backbone of our work together. From the very beginning of my term as Regional Director, now approaching its 2-year mark, I've held firm to a simple truth. We cannot manage what we cannot measure. Our regional vision calls us to deliver results and to do so with precision. That's why this year we've taken a significant step forward. We've established baseline data for 10 of the 18 delivery for impact indicators, country by country. These indicators are not just numbers. They are a reflection of lives improved, systems strengthened, and futures protected. This report also includes comparative country profiles drawn from authoritative sources to help us see where we stand and where we must go next. Because in this region, we don't just celebrate progress, we measure it, we own it, and we build on it together. First, transformative primary health care for universal health coverage. At the heart of our regional vision lies a simple but powerful truth. Health must be accessible to all, not just to some, under the umbrella of universal health coverage. Over the past 2 decades, we have seen remarkable progress. The Universal Health Coverage Service Coverage Index in our region rose from 44.1 in 2000 to 75.6 in 2021, proving that the commitment of our member states. But progress has slowed since 2019, and the pandemic has exposed deep cracks in equity. Catastrophic health spending has more than doubled, placing unbearable pressure on families. And service coverage still ranges widely from 30% in one country to 89% in another, highlighting persistent disparities, especially in our Pacific Island nation. Yet there is hope. Countries are stepping up with bold reforms and renewed energy. Just a few examples. China's National Healthcare Security Administration is building systems to finance long-term care for older people in partnership with the Ministry of Finance and the National Health Commission. The framework for sustainable health development in the Federated States of Micronesia sets a clear path for investment and coordination. Vietnam now covers 95% of its population under public health insurance, with reforms introduced last year to enhance quality and efficiency. But achieving UHC means tackling the deeper drivers of health system effectiveness, such as antimicrobial resistance, or AMR. This year, we saw strong momentum. Papua New Guinea and the Philippines strengthened their national AMR guidelines and plans. Fiji, Nauru, Palau, and Tonga received AMR surveillance training. Despite global funding challenges, our region is pushing forward on the unfinished agenda of communicable diseases. Cambodia is nearing malaria elimination. Lao PDR is closing the gap on schistosomiasis. Papua New Guinea screened 79% of its target population for neglected tropical diseases. Fiji, French Polynesia, and Wallis and Futuna led mass drug administration against lymphatic filariasis. And Vietnam was recognized for eliminating trachoma. On non-communicable diseases, countries are strengthening surveillance and care. Fiji, Nauru, Niue, and Tuvalu updated their NCD data using the WHO STEPS approach. The Philippines achieved 85% hypertension control in one province in its Healthy Hearts program, now scaling up nationwide. Solomon Islands enhanced diabetic food care through coaching and quality improvement, reducing wait times and expanding services. Tuberculosis remains a major challenge, but innovation is driving progress. Cambodia cut TB mortality by 50% and incidence by 42% since 2000, using AI-assisted chest X-ray screening. Mongolia adopted a system optimization strategy in its 2025-2028 National TB Plan. And immunization efforts continue to protect millions. Cambodia responded to a measles outbreak with a campaign reaching 1.5 million children. The Federated States of Micronesia, Vanuatu, and Tonga strengthened immunization policies and lab testing. On HPV vaccination, Lao People's Democratic Republic has vaccinated more than 600,000 kills since 2020, with 80,000 more in the past year. Mongolia aims to reach 90% coverage for 11-year-olds, with 40% already vaccinated. A strong health workforce is the backbone of equitable care. While physician and nurse numbers have improved, pharmacist density remains low, but countries are responding. The Philippines launched the Field Back initiative with Pacific Island countries to address chronic shortages through mutual exchanges. Cambodia, Fiji, Papua New Guinea, and Solomon Islands developed long-term workforce strategies. In transformative primary healthcare is also gaining ground. China is piloting integrated care for 59 million people with digital solutions and financial reforms. Nurses in Brunei Darussalam led national screening for major NCDs, including cancers. Kiribati, Nauru, and Tonga enhanced pharmaceutical systems. This is what transformative primary healthcare looks like: bold, inclusive, and rooted in the realities of our region. Together, we are not just closing gaps, we are building bridges. And we are proving that with the right vision, the right tools, and the right partners, UHC is not just possible, it is well within reach. Turning now to climate-resilient health systems, building strength where it matters most. In the Western Pacific, climate change is not a distant threat. It is a daily reality. Rising sea levels, extreme weather events, and shifting rainfall patterns are already reshaping the health landscape across our island and coastlines. Our health systems must evolve, not just to survive these changes, but to thrive despite them. Recent data from 16 countries show that 88% of healthcare facilities have access to basic water services. But that also means more than 1 in 10 still lack this fundamental necessity. In 4 countries, primarily in the Pacific, coverage falls below our regional target of 80%, with 2 countries below 70%. But water access is just the beginning. It is the floor, not the ceiling, of climate resilience. To truly safeguard our communities, we must invest in solar energy, infrastructure retrofitting, and workforce training, and we are doing just that. Here, let me specifically mention climate resilient projects supported by the Korea International Cooperation Agency, or KOICA. In Fiji, the Verata nursing station was reopened after major renovations and solar power installation under the SHAPE project, a multi-year initiative led by KOICA, W.H.O, and the Ministry of Health and Medical Services. The SHAPE project has strengthened 5 other health facilities, installed solar power in 18 facilities, trained more than 600 health workers, and enhanced disease surveillance and community adaptation. In Kiribati, the Tema Maori Koika initiative is assessing climate risk and building culturally appropriate resilience strategies for our islands. On another front, proximity to the sea is a wake-up call. A recent survey across 14 Pacific Island countries revealed that 62% of health care facilities are located within 500 meters of the coastline. In low-lying atoll nations, such as Kiribati, Marshall Islands, Nauru, Palau, Tuvalu, and Tokelau, every single health facility falls within this vulnerable zone. These findings underscore the agency of adaptation, not just in policy, but in physical infrastructure. Our region is not alone in this journey. Through the Alliance for Transformative Action on Climate and Health, or ADACE, more than 95 countries and areas have committed to building climate resilient and low carbon health systems. Many Western Pacific countries are active members, contributing local knowledge and benefiting from global collaboration. We have so many examples of climate adaptation in action. China launched its first National Action Plan on health adaptation to climate change, involving 12 ministries in a coordinated framework. Solomon Islands and Fiji developed national health adaptation plans. Vietnam hosted a national conference on air pollution and is implementing climate resilient infrastructure in hospitals, including solar energy and water systems. Resilient health systems are not built in calm waters. They are forged in the storm. In a region as diverse and dynamic as ours, health security is not just a technical goal, it is a moral imperative. We know that resilience begins with preparedness. That's why countries across our region are strengthening core capacities under the international health regulation. This past year, we have seen bold leadership and decisive action. In Mongolia and Singapore, careful reform led to the launch of Centers for Disease Control, sharpening the public health system architecture and evidence-informed decision-making. Public health emergencies operation centers are now equipped and trained in Fiji, Mongolia, Tonga, and Vanuatu, a major achievement for efficient emergency response. Cambodia and Cook Islands launched their national pandemic preparedness plan, advancing their readiness poster for future respiratory disease pandemic. Cook Islands, Lao PDL, the Philippines, Solomon Islands, and Vanuatu conducted the IHR Joint External Evaluation, or JEEs, to prioritize measures for more effective health security. Samoa and Cambodia developed comprehensive national action plans for health security informed by the JEEs. The cooperation between countries on the IHR is notable, and I want to thank Australia, China, Japan, New Zealand, Republic of Korea, and Singapore for funding IHR health security work, including JEEs in our region. Cambodia, Mongolia, Philippines, and Samoa have leveraged their JEE's findings to be awarded pandemic fund grants with $65 million. Through the connected country leadership, we have seen more timely IHR event notification, shifting from a median of 20 days in 2023 to 2 days in 2025. I thank countries for their commitment to obligations under the IHR that protect the health of people everywhere. Turning now to surveillance and laboratories, the front line of detection. Multiple outbreaks from dengue to leptospirosis, measles, and HIV were experienced by multiple countries and areas, including Fiji, French Polynesia, Guam, Kiribati, Mongolia, New Caledonia, the Philippines, Samoa, Tokelau, Tonga, Vanuatu, and Vietnam. Of these, 6 received life-saving supplies with $806,000 from W.H.O. emergency stockpiles, generously enabled by China and Japan. And 3 received technical experts under the Regional Global Outbreak Alert and Response Network to bolster their responses. Laboratory capacity is the cornerstone of effective outbreak response. Today, only 15 countries in our region, or 53%, have in-country sequencing capabilities and capacities. The rest, mostly in the Pacific, rely on external laboratories. Our goal is to increase this to 70% by 2029, with at least 4 more countries building their own capacity. We are already seeing progress. The pathogen genomic laboratory at the Fiji Center for Disease Control is now equipped to rapidly detect and respond to threats like influenza, COVID-19, and Mpox. Laboratories in Papua New Guinea and 7 other countries are being trained in sequencing by Australia's Centre for Pathogen Genomics to establish and strengthen end-to-end genomic surveillance capacities. I am proud of the progress made in emergency medical teams region-wide. EMTs from Singapore, the Philippines, and the Pacifica Medical Association achieved global classification, and Fiji's team was reclassified. This means that as of 30 June, our region hosts 40% of 17 out of 41 classified EMTs globally. And I must take a moment to recognize that in the last week, Indonesia had its first EMT join the ranks of classified global teams. EMTs from our region continue to be among the first to respond when emergencies strike. EMTs from Australia, Japan, the Philippines, and Singapore were deployed to Myanmar in response to devastating earthquake. And Vanuatu coordinated the deployment of EMTs from Australia, Fiji, Indonesia, Japan, and New Zealand, along with its own VENMET, in response to last December's earthquake. EMTs also support mass gathering. A joint Samoa and New Zealand EMT was activated for the Commonwealth Heads of Government meeting in Samoa. And Papua New Guinea's EMT was activated for Papal visit last September. This is what resilience looks like: communities that are prepared, systems that are responsive, and societies that stand ready to protect their people. Honorable ministers and distinguished guests, we are not just building capacity, we are building confidence, we are building trust. And we are building a region where health security is not a privilege, but an interwoven promise. Resilience is not just the absence of crisis, it is the presence of strength, strategy, and solidarity for healthier people throughout the life course. Health is not just about access to services, it's about the environments we live in, the choices we make, and the systems that support us from birth to old age. In the Western Pacific region, we are shifting our focus upstream towards the social and commercial determinants of health to prevent disease before it begins and to promote well-being across every stage of life. Healthy aging is advancing through lifelong promotion, supportive policy, and age-friendly environments, with China expanding integrated care for older people and the Philippines rolling out a national plan and age-friendly initiatives. Oral health, a long-neglected issue, is also rising on the agenda, marked by the W.H.O. Global Oral Health Meeting in Bangkok and advanced through country action. This includes the Philippines policy development and training toolkit so primary healthcare providers can deliver essential oral health services. This year, countries have made meaningful strides in adopting WHO best practice for NCD's prevention. 17 of the region's 38 countries and areas have fully or partially implemented at least 10 of the 15 recommended interventions. But 7 countries still lack sufficient data, highlighting the urgent need for stronger policy momentum and technical support. We must invest in better data systems to track progress, verify outcomes, and ensure that no community is left behind, because what gets measured gets improved. Tobacco control remains a regional priority. Tobacco use is one of the most preventable causes of death in our region. While many countries have advanced tobacco control, tobacco use prevalence remains high. And the rise of electronic nicotine and non-nicotine delivery systems is deeply concerning, especially among our young people. But our region is responding with bold action. Cook Islands raised the legal age of sales to 21, increasing tobacco taxes by over 50% over the next 3 years, and has declared 4 islands smoke-free, the result of 2 decades of community-driven advocacy. Cambodia designated Battambang and Kampong Cham as new smoke-free tourism cities, protecting more than 200,000 people from second-hand smoke. Marshall Island is using the global Youth Tobacco Survey to inform legislation and protect adolescents. Vietnam banned e-cigarettes and heated tobacco products starting 2025 January, and has approved the revised excise tax law to increase tobacco tax. And Australia changed its law so that all vapes and vaping products with or without nicotine can only be sold in a pharmacy for the purpose of helping people to quit smoking or manage nicotine dependence. Healthy diets and alcohol control are the next frontier in tackling NCDs. While tobacco control is gaining ground, far fewer countries have implemented strong measures on alcohol consumption and unhealthy diets. That's why alcohol control is a key agenda item at this week's regional committee. Still, there are bright spots. Vietnam approved an alcohol tax increase, aiming to curb alcohol consumption nationwide. Singapore became the first country in the region to eliminate industrially produced trans fats from its national food supply and receive W.H.O. validation certificate. Cambodia rolled out a national salt reduction campaign, and Papua New Guinea updated its NCD protocols and training manuals to align with WHO best practice. Another area where our region simply must do better is injury prevention, including a focus on road safety. Needless injury and death can be prevented through relatively simple measures and strict enforcement. Vietnam passed legislation requiring children under 10 to sit in rear seats as part of a broader strategy. And Metro Manila launched a Road Safety Action Plan 2024-2028 for its 15 million residents. Here I would like to report far more progress next year, as we have a long way to go. On a brighter note, mental health is finally receiving the attention it deserves. Singapore Health Services Community Hospitals were designated the first WHO collaborating center for social prescribing, and Palau finalized an analysis to inform its national suicide prevention strategy advanced through school health programs. There is a growing need to focus on our young people region-wide, given the burden of mental health issues they increasingly face. Health is a journey, not a destination. And in our region, we are walking that path together towards healthier lives, stronger communities, and a future in which prevention is also powerful as cure. When we invest in health across the life course, we don't just add years to life. We add life to years. In today's world, data is more than numbers. It's a lifeline. When collected and used wisely, health data can transform how countries identify priorities, make investment decisions, and course correct policy to ensure no one is left behind. Yet many countries in our region remain off track to meet their health-related SDG targets. The challenge is clear. We must strengthen our health information systems to monitor progress, guide action, and build trust in our decisions. While we've seen improvements in population surveys and health service data, many countries still struggle to track key indicators relying on global estimates that may not reflect local realities. But there is momentum, and it's growing. Lao PDL piloted a program to send vaccine reminders via text message to 50,000 parents, improving immunization follow-up. Malaysia introduced its first national health literacy policy, integrating health education across schools, media, and digital platforms. Brunei Darussalam expanded the Pro Health platform, originally built for COVID-19, to help individuals manage appointments, screenings, and medical records. Papua New Guinea developed its National Digital Health Strategy 2025-2030, aligning with global frameworks and incorporating inputs from national and local stakeholders. As we look ahead, we must prioritize areas that will deliver the greatest impact. Immunization, especially childhood vaccination, remains our top priority. Declining coverage in some countries, often triggered by disinformation, threatens public health and safety in our region and around the world. Hypertension control is a low-cost, high-impact intervention that can dramatically reduce premature death from stroke and heart disease. Tobacco and alcohol-related morbidity must be tackled through proven WHO best practices and policy reforms. Oral health must be integrated into primary health care, supported by lifelong promotion and policies. A healthy mouth and smile are fundamental to daily life. Healthy aging shapes future-ready social and health systems. This includes primary health care-led integration with community long-term care, caregiver support, and age-friendly environments. Safe water in healthcare facilities is essential, especially as 70% of our population live in coastal areas vulnerable to sea level rise and flooding. Emergency preparedness must be rooted in community inclusion and resilience. And as we accelerate the use of AI and digital technology, we must ensure these tools are accessible to all, bridging gaps, not widening them. Innovation in health is not about machines, it's about meaning. It's about making every life count. The vision of health for all, the foundation of WHO mandate in the Western Pacific region and globally, is not a distant dream. It is a tangible goal, and this report shows that it is within reach. Our member states and partners are providing the progress is possible, and they prove that this is possible even in the most challenging of times. As we enter the next biennium, we are called on to do more with less. We must deliver services more effectively, more equitably, and more innovatively. The world around us is uncertain, but the pathways forward are becoming clearer. These pathways are not forged by chance. They are shaped by the determination of the weavers of health across our region. Together, we are not just responding to crisis, we are building systems that endure. We are not just treating illnesses, we are nurturing well-being. And we are not just managing programs, we are protecting futures. At the heart of it all is a simple truth. Health is a human right. It belongs to every child, every elder, every family, and every community. It is the thread that binds development, dignity, and hope. Just after I conclude this address, we will be recognizing a number of member states whose accomplishment in eliminating specific diseases as public health threats truly symbolize health as a human right. Kudos again to Fiji and Papua New Guinea for eliminating trachoma. To Japan for eliminating rubella. And to 21 Pacific Island countries and areas for eliminating measles and rubella. Let me now close with a quote that captures the spirit of our journey. Weaving health is not about perfect threads. It's about the strength of the weave. And when we weave together, we create a fabric strong enough to carry generations. Honorable Ministers, thank you for your leadership, your partnership, and your unwavering commitment to health for all. Let us continue this journey together. I thank you, and Vinaka Lakalevu.
Thank you very much, Dr. Piukala, for your very, very informative brief on your report. Remember the delegates of the Western Pacific region. And may I now call on the Secretariat before we proceed with interventions.
Thank you, Chair. As you heard during the Regional Director's address, Fiji is to receive recognition for the elimination of trachoma. Congratulations, Fiji. May I call on the Chief Delegate, our Chairperson, the Honourable Mr. Lalabu, Minister for Health and Medical Services of Fiji, for a brief presentation. Thank you, Minister, and congratulations again, Fiji. I now call on Papua New Guinea's Chief Delegate, the Honourable Elias Kapavori, Minister of Health, to receive the certificate, recognising PNG's elimination of trachoma. Congratulations, Papua New Guinea. Thank you, Minister Kapavori, and congratulations again, Papua New Guinea. Next, as the Regional Director also mentioned, Japan is to receive recognition for rubella elimination, as verified by the Regional Verification Commission for Measles and Rubella Elimination. May I call on the Chief Delegate of Japan, our Vice Chairperson, Dr. Satoshi Azoe, Senior Assistant Minister for Global Health, to come to the front for the presentation. Congratulations, Japan. Thank you, Dr. Izoe, and congratulations, Japan. Lastly, may I request again the Fiji Minister for Health and Medical Services and our chairperson, Minister Lalam to receive the certificate on measles and rubella elimination on behalf of the Pacific Island countries and areas. Congratulations to the Pacific.
Thank you very much, Ms. Davison. We now go to distinguished representatives for their comments on agenda item 7. And before commencing interventions, I would just like to reiterate what Dr. Mercado has mentioned earlier before, that you speak clearly, slowly for the benefits of the interpreters as well as the translators, and also being concise in reply to the regional director's speech. And please indicate your wish to speak by clicking the button on the bottom right side of your microphone. Thank you. Accordingly, may I call on apologies. Accordingly, may I call on the Philippines?
Thank you very much, Dr. Saia Piukala, the WHO Regional Director for the Western Pacific, Honorable Antonio Rabici Lalabalalu, the Chair of the Regional Committee meeting, Honorable Excellencies and Ministers, delegates, and colleagues, a pleasant good morning. Bula Vinaka. Sitius, Altius, Fortius Communitae. Faster, higher, stronger together. These were the words with which I had the honor to close the 78th World Health Assembly in Geneva last May 2025. On behalf of the Philippines, I extend our deep gratitude to the member states of the Western Pacific for your unwavering support. It was a privilege as a Western Pacific nation to preside over the adoption of the pandemic agreement and to warmly welcome Indonesia into our regional office. In that same spirit, the Philippines will, with deep respect and renewed resolve, welcomes the report of the regional director. Indeed, the report is a testament that in the Western Pacific, progress, like the intricate strands of a woven mat, is never crafted in isolation. We build, we uphold, and endure together. The Philippines recognizes the importance of primary health care and has translated universal health coverage from political aspirations into legislative and operational infrastructures. Under the Universal Health Care Act in the Philippines, all Filipinos are automatically enrolled in the National Health Insurance Program, and 104 UHC integration sites are consolidating fragmented municipal health units into province or city-wide health systems with unified financing, referral pathways, patient navigation, and governance structures. On financial protection, we have expanded capitation-based primary care financing with Philippine Health Insurance Corporation's YACAP and provider network contracting and the standardized PhilHealth accreditation for over 3,400 primary care facilities. Primary care level service delivery is also being expanded through 56 bukas or bagong urgent care and ambulatory service centers and the nationwide implementation of our public health programs through Purok Kalusugan. As the highest ranked country in the World Risk Index for 3 consecutive years, the Philippines has embedded climate-adjusted disease surveillance, resilient facility design standards, and low-carbon energy pilots in hospitals in line with the WHO ACE guidance into the National Health Adaptation Plan. However, we underscore that health remains structurally underrepresented in the global climate finance mechanisms. Thereby, we urge the establishment of dedicated health windows within the Green Climate Fund and the Loss and Damage Fund Facility, a regional technical framework for climate-resilient health facility standards, and an ASEAN Western Pacific Regional Office coordinated regional stockpile mechanism for climate-sensitive medical countermeasures. If our health systems crumble with every typhoon or every earthquake, UHC collapses overnight. Resilience must be built ex ante, not pieced together post-disaster. We will achieve health system strengthening for a resilient and climate-resilient health system. The Philippines remains steadfast in upholding international health regulations, aligning our legal and administrative frameworks with emerging global agreements on the pandemic prevention. Guided by our recent joint external evaluation, our National Action Plan for Health Security centers on 3 priorities. 1, strengthening surge-ready workforce capacity. 2, integrating information systems across human-animal environment interface under the One Health framework. And 3, upgrading seaports and international airports as designated points of entry. The Philippines applies a structural approach to health promotion, recognizing that health outcomes are shaped by the environments in which people live, move, learn, and eat. Through the Healthy Settings program, national standards are locally adapted across 93 local government units, 55 schools, and over 1,300 workplaces, guided by unified monitoring indicators. Complementing these measures, tobacco, alcohol, and sugar taxation continue to reduce population-level exposure risk while financing UHC subsidies, demonstrating dual public health and micro-fiscal benefits. Lastly, through the Philippine Pacific Health Initiative, the Philippines is codifying bilateral and multilateral health and care workforce development models with the Pacific Island states. Moving from policy to action, implementation has begun through the deployment of technical teams to the island of Chuuk in the Federated States of Micronesia, Tonga, and this November to the island of Ponape, supporting capacity building and system redesign. In closing, the Philippines asserts that regional health progress depends on institutional durability, financial predictability, and interoperable systems, interlinking countries through a common vision. The mat of weaving health will only endure if each strand is tensioned with discipline and collaboration, not just goodwill. The Philippines stands ready to keep weaving this shared foundation with all Western Pacific member states, purposely, deliberately, and without leaving a single thread behind. Mabuhay, Bula Binaka.
Thank you, Minister Ted. Just for you, the information of the delegates, please ignore the list that is on the screen, but rather the list that is in the screen on your on the microphone. That with being said, we will follow with interventions from France, and since it is nearing lunchtime, thereafter will be followed by the Republic of Korea, Japan, and we'll take Brunei Darussalam before we break for lunch. So may I call upon France to be followed by the Republic of Korea.
Thank you, Mr. Chair. I will be speaking in French. Monsieur le Président,
Chair, Regional Director, Ministers, colleagues, France salutes the constant efforts by WHO and its Western Pacific Regional Director and its unfailing commitment to health promotion in the region, constantly re-demonstrated the various crises which we have to face today are not isolated events. They are mutually reinforcing events with multipliers which are often having a dramatic impact on health in the region. France salutes the determining and effective action of WHO. We wish to restate that we maintain our commitment alongside you. We want to work with all the regional health agencies. France strongly supports the strengthening and prioritization process you are conducting, Mr. Regional Director. This is essential to give more efficiency and transparency to your action and meet member states' needs more fully. Thank you for your action, which must be implemented while protecting the well-being of SPC staff. We thank you for your professionalization. The prioritization decision must be conducted in close coordination between the headquarters and regional offices. We need to bear in mind various thought processes going on about the World Health Architecture. We salute your health professional training activities, which will make it easier to implement the World Health Strategy. It's a priority for the region. We believe that this is, referring to the WHO Academy, a powerful lever to offer innovative and high-quality training in the region. In the Western Pacific, France continues to actively support this project, illustrating the shared ambition of innovatory future-oriented training. We congratulate and commend you in adopting the first international agreement on pandemics at the 78th Assembly of Member States. This is the fruit of 3 years of intensive negotiation and strengthens the World Prevention framework, and we believe this provides clear obligations on reinforcing and prevention activities in each state, and the One Health approach is the fundamental foundation for these efforts. We thank you for your driving force showed in pioneering this approach in the region. Collective long-term mobilization will be one of the major themes of the One Health Summit France will be hosting in 2026, and we would like to call for collective efforts to finalize the annex of the agreement on the pathogen mechanism access process, and we would also draw your attention to the shared benefits which could be achieved by May 2025 on the basis of our signature and ratification of the agreement. Thank you.
Thank you. May I call upon Republic of Korea, to be followed by Japan.
Honorable Regional Director and delegations from our members, the Republic of Korea would like to express its full support for the report of the Regional Director, which symbolizes the shared efforts for promoting health in the Western Pacific region. Weaving health for families, communities, and societies in the Western Pacific region clearly envisions the direction to which the collaboration among WHO and its members should go. As a key partner with this vision, Korea is delivering tangible outcomes in diverse areas
including digital health, addressing infectious diseases, universal health coverage, and mental health from the close cooperation with the WHO and W.H.O. Korea is actively participating in the shared effort for addressing global health challenges, and that is well demonstrated by its hosting of the Asia-Pacific Economic Cooperation high-level meeting on health and the economy last month, where Korea, as the chair, led the adoption of the joint statement on promoting healthy and active aging in a changing demographic landscape, building a sustainable health systems and improving health for all, harnessing digital health and AI to transform health systems, strengthening community-based primary health and care services, and so on. Along with that, Korea is materializing the goal of GPW14 and the Western Pacific region in its domestic policies. Amid demographic changes caused mainly by low birth rates and population aging, Korea is prioritizing people-centered primary health service in its strategies for managing NCDs. For instance, a doctor in a primary medical institute establishes plan for managing individual patients and assist the patient's self-management with continuous counseling and education. We found this has led to meaningful outcomes, such as increased treatment rate for hypertension and diabetes. Also, we have strong measures in place for reducing major risk factors. We implement rigorous policies to discourage smoking that involve raising the price of a cigarette, inserting warning images on the cigarette package, and expanding non-smoking areas in public places. Not only that, we make efforts for reducing risk factors such as obesity, drinking, and lack of physical activity by running customized health promotion programs for local communities in collaboration with local governments. In addition, we are bolstering digital transformation in the health system, including by actively implementing a project named My Health Way, in which pieces of medical information scattered across multiple institutes are gathered in one place and provided for medical staff and patients, and are seeking ways for utilizing AI as a key solution for tailored treatment, patient-centered management, and efficient medical care. We are still facing a lot of tasks to tackle. The issue with growing health expenses due to population aging and novel infectious disease outbreak following climate change require effort from all of us. As a reliable partner for women's health, the Republic of Korea will continue its material and human resources support through WHO for ensuring all the people in the Western Pacific region to enjoy a healthier life. Thank you.
Thank you. I call upon Japan to be followed by Brunei Darussalam.
Mr. Chairperson, Director General, Regional Director, distinguished delegates, ladies and gentlemen. Bula, it is a great honor to speak on behalf of the government of Japan. I wish to express my sincere appreciation to Regional Director Dr. Piukala and the Secretariat for their leadership and close engagement with member states. I also thank the government of Fiji for graciously hosting the 76th Regional Committee meeting and warmly welcome Indonesia to the W.H.O family. Japan remains firmly committed to working closely with the Regional Director and all member states to address the evolving health challenges in our region. I would like to highlight key points. In today's complex global health landscape, we commend the Secretariat's efforts toward governance reform. Japan fully supports WHO's prioritization process and is focused on fulfilling its core mandates, setting norms, convening partners, and managing infectious disease crisis. with the overarching goal of achieving universal health coverage, or UHC. As the regional director highlighted, achieving UHC by 2030 remains our shared goal. Japan is advancing the UHC Knowledge Hub in collaboration with WHO and the World Bank to support developing countries through knowledge sharing and capacity building, especially in health financing and policy development. In addition, Japan will host the UHC High-Level Forum in Tokyo in December 2025 to further strengthen global momentum toward UHC. With population aging and lifestyle changes, addressing non-communicable diseases and mental health is increasingly important. Japan continues to support WHO's work, especially in small islands developing states, focusing on vulnerable populations. We welcome the adoption of the main text of the WHO Pandemic Agreement at the 78th World Health Assembly. Japan contributed actively to the International Intergovernmental Negotiating Body, INB, including as vice chair representing W.H.O, and will remain engaged in the annex negotiations. Finally, climate change and health are urgent challenges for our region. Japan will continue to address them through the Alliance for Transformative Action on Climate and Health, ATTACH, sharing knowledge, best practices, and strengthening collaborative networks. Mr. Chair, Japan will continue to stand with the W.H.O family and the global community to protect and promote health and well-being and to build a better, healthier future for all in this region. Thank you very much, and Vinaka.
Now, Wakalewu, Japan, may I now call upon Minister Isham Jaffa from the Brunei Darussalam. The floor is yours, sir.
Thank you, Honorable Chair. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh, and a very good afternoon. Honorable Chair, Excellencies, fellow delegates, ladies and gentlemen, Brunei Darussalam expresses our sincere appreciation to World Health Organizations for its continued leadership and unwavering commitment to advancing health and well-being across the Western Pacific region. We also like to thank Fiji government, in particular Ministry of Health, for their gracious hospitality and organizing this 76th session. Brunei Darussalam also warmly congratulates and welcomes our close neighbor, Indonesia, on its recent transition to the Western Pacific region. Selamat datang, Bapak. We are confident that Indonesia's wealth of experience and leadership in public health will greatly enrich the work of this regional committee. We look forward to strengthening collaboration as fellow ASEAN member states within the W.H.O family. Honorable Chair, Excellencies, ladies and gentlemen, we commend WHO Regional Office for the Western Pacific for its innovative approach in 2024-2025 report of the Regional Director, particularly the introduction of country-specific indications. This data-driven methodology allows us to benchmark our own progress, learn from regional peers, and identify where WHO support can add the greatest values. Brunei Darussalam acknowledges the importance of the Regional Director's vision, weaving health for families, communities, and societies in the Western Pacific region. In Brunei, our own priorities resonate closely with this vision. Universal health coverage remains a cornerstone of our health system, and we continue to strengthen primary care, surveillance, and emergency preparedness so that services are resilient even in the face of shocks such as pandemic and climate change. We also recognize the central role of communities in sustaining trust, whether in immunization, prevention of NCDs, or risk communication during emergencies. Honorable Chair, we note that this regional committee meets at a historic moment. At the World Health Assembly in May this year, Member States adopted the Pandemic Agreement, marking a milestone for global solidarity. Work is also progressing on the Pathogen Access and Benefit Sharing Annex. In parallel, the amendments to the International Health Regulations adopted in 2024 entered into force this September. Together, these instruments signal a new phase of global health governance. Brunei remains committed to ensuring that they translate into stronger preparedness and more equitable response capacity across our region. At the national level, we are strengthening our multi-sectoral platforms on antimicrobial resistance and zoonosis, advancing nutrition and NCD prevention with a special focus on the first 1,000 days of life through the development of our strategic plan for maternal, infant, and young child nutrition 2025 to 2030, and enhancing the resilience of our health laboratory system. We're also leveraging digital health through BruHealth 5.0 to empower individuals, improve surveillance, and integrate preventive care. Honorable Chair, Excellencies, ladies and gentlemen, Brunei Darussalam reaffirms our commitment to work closely with WHO and fellow member states to weave stronger, more resilient health systems for our families, communities, and societies across the Western Pacific region. And Brunei Darussalam is so proud to announce our financial commitment to WHO investment round, and this pledge reflects our belief in the central role of WHO and our determination to contribute in solidarity with other member states to a stronger and sustainably financed organizations that can better support countries in achieving health for all. Thank you.
Thank you, Minister Jafar. We will now suspend this item and break for lunch. We will resume consideration of this item immediately after lunch. But before we take a break, may I call on the Director, Administration and Finance, Dr. Tamas Landes, for the administrative announcement.
Thank you very much, Mr. Chair. I would like first to make a few announcements about the planned proceedings for the rest of the day. The afternoon session will reconvene at 2 p.m. For the members of the informal working group on the executive board seats allocation for the Western Pacific region, your meeting will take place at 12:30 in the hallway just across in the Reva room. Please note that this is only for registered informal working group members. The Daily Journal is now available on the W.H.O website and through the W.H.O Events app. The QR codes for the app, which includes also Bula bot, are placed on the walls in the conference halls and also in each meeting room for your convenience. If you prefer a hard copy, we have the daily journals available at the inquiry desk just outside the conference hall, and our colleagues are, of course, happy to assist you. Any corrections to the journal should be noted and submitted to the inquiry desk, please. Now about lunch. Starting today, daily lunch for all participants will be served at the Island 619 and the Tatawu Grill and Bar. These are located on the same floor, on the ground floor, as you walk towards the lobby and then towards the pool area to the left. As you move towards the lunch venue, I would also like to invite you to visit the photographic exhibition just outside, the hall titled Voices of a Generation. It's a powerful collaboration between the Kiribati Ministry of Health, the National Geographic Society, COICA, and WHO, showcasing stories captured by young people from Kiribati who documented the realities of climate change and health in their communities. Through their photos, captured just last week, you will see both the challenges they face and the hope they carry, a reminder of the future we all are here to protect. In addition, just outside this conference hall to my left, we are showcasing curated displays of health innovation and achievements titled Weaving Health Futures, a tapestry of innovation, collaboration, and community. Please ensure to visit them. I have been told that you might just take some special prizes when you pay them a visit. Now, some general announcements. For security reasons, please kindly wear your badges at all times during the sessions and the receptions. Those who have questions about badges, please contact the inquiry desk. As part of WIPRO's ongoing green initiative, we are reducing plastics and also papers. If you would like RCM documents, including the resolutions in printed form, they are available also at the inquiry desk at your request. QR codes are linking specific publications published digitally on the WHO's IRIS repository can be accessed next to their display copies at the publication desk outside this conference hall, and hard copies also can be ordered from the publication unit. There's also an internet cafe just beside the inquiry desk. Wireless internet is available. The QR codes for that are also on the walls in every meeting room and this plenary hall. Transportation schedules. They are available at the inquiry desk, and we have transportation to and from the meetings. Please leave the wireless receivers and the headsets in the conference hall during the coffee breaks and after the sessions. Hard copies of the list of representatives will be placed outside the inquiry desk, and kindly verify the information of your delegation to ensure accuracy of our records, and submit updates if needed to the inquiry desk. This is important to ensure the accuracy of our records. Many thanks for your indulgence and support with this. We would like to finish it by the end of today. If you are located in the Denarau Island, the Bula bus is the best way to get around. It offers easy access to all resorts and key spots with flexibility to jump on and off as needed, and the services run from early hours to the late hours every 15 minutes. We appreciate your cooperation and flexibility as we navigate through the week together, and updates will be shared daily via the journal, the RCM app, and the Secretariat announcements. Should you have any questions, our admin team is available to assist you. For any emergencies, you may contact myself and my colleagues Dushan and Hassan. They are there. Please stand up so you can identify them. And our phone numbers are on the wall also in each conference room and the plenary in case you need to reach us. Given that this is one of the biggest and highest level public health events in the world, we wish to avoid transmission of infection. If you are feeling ill or coughing, we kindly request you to wear masks, and we have some masks available at the inquiry desk for your support. Lastly, I would like to remind all visitors of W.H.O.'s non-smoking and no-alcohol policy. Thank you, and we look forward to successful RCM 76. Thank you, Mr. Chair. Bula Vinaka.
Thank you, Dr. Andes. We will now break for lunch, and we will reconvene at 2:15 p.m. Thank you very much. Enjoy your lunch.